present. There's a swelling present in
Where?
the
Where?
right,
Location?
right hypochondrial region of size approximately 5 into 5 centimeter. We see that there is discoloration of the skin, no visible veins or no visible pulsations.
What about the skin? Is it normal?
No, sir. The skin is discolored. It's almost purple.
Anything else?
Inflammatory signs.
You have a
No
punctum.
puncta seen, no puncta.
Huh? No puncta? There is a punctum.
There is a
This is a punctum.
दिया मोबाइल हटा लो टॉर्च
There is a punctum? Yes? Okay. Now, once you have done that, then you have to confirm your findings of inspection. है ना? तो पहले temperature देखो. नहीं, not first. You have to see the normal side, and then go to that. 2 fingers and put it. Yes.
Sir, it is febrile. The temperature.
Febrile or temperature is raised? Temperature is raised. Then the second thing you have to see for tenderness. Wincing with pain. These are very obvious things. So there is local temperature is raised. It is tender on touch. है ना? और एक मिनट अब कुछ नहीं करे हो गया जो कुछ करना था. अब now you confirm the findings. So what is the exact size? You said 5 into 5, which is not correct. It is around 6. Torch दिखाओ. देखो, this is the extreme end, and this is the other extreme 6. By vertically, it is only 3 centimeters. 3. So it is 5 transversely and 3 centimeters vertically, and it is tender and it has got a punctum. The third thing is to see pinching test. For example, I am pinching here. I am able to raise the skin. Whether this can be done here or not, it's not possible. So pinching test is negative. Then you can see for mobility, it is mobile. It is mobile over the muscle. It is in the skin itself. So now let us summarize. कितने दिनों से है ये?
ये करीबन
1.5 साल. हाँ? कभी कभी ऐसा लाल हो जाता है, कभी ठीक हो जाता है.
लाल हो जाता है, बिल्कुल नील ऐसा दिखता है.
हाँ.
इसमें जलन भी होती है.
हाँ, नहीं तो जब लाल हो जाता है तब तकलीफ होती है. ऐसा तो नहीं होती तकलीफ. So she has this swelling for 1.5 years, which is sometimes reddish in color, painful, and at other times it is normal. Now on inspection we have found that it is about 3 into 5 centimeters. It has got a punctum. It is reddish in color. Local temperature is raised. It is tender. So now what is the differential diagnosis?
Sebaceous.
Obvious. Local temperature is raised and tenderness is for any abscess. है ना? So now if you are saying sebaceous cyst, you have to say infected sebaceous cyst. Infected sebaceous cyst means the cyst is there, now bacteria has entered and it has got inflamed. So now the problem, what is the differential diagnosis? Cellulitis is one. Second, you can say a lipoma. है ना? A simple parietal abscess. Any inflammation, tenderness, or in a diabetic patient, you can say carbuncle, fruncle, etc. So there are so many differential diagnoses. There are two. First is the pathology and then the complication. The pathology in this case is sebaceous cyst. Why it is a sebaceous cyst? It is in the skin. You cannot pinch the skin separately. Second, it has got a punctum and it is superficial. So these are the 3 points which favor the diagnosis of sebaceous cyst. Why it is inflamed? Because the local temperature is raised, it is tender and it is reddish in color. So now it is a case of straightforward infected sebaceous cyst. Now the question arises, how will you confirm the diagnosis? Is there any way to confirm it? I think 99% it is a clinical assessment. If you clinically diagnose it, other point is you can do a FNAC which is not indicated in this. Why it is not indicated in this? Because if you puncture it, it is a cyst containing liquid. So as soon you put a needle, it will form a sinus. So FNAC is not correct for this particular case. If it was a lipoma or fibroma or any other pathology, FNAC would have been the investigation of choice. In this case, it is just the clinical assessment. So now we have a patient, it's 1.5 years, she has not got any response. कितने डॉक्टर को दिखा चुकी है आप? किसी को नहीं, पहली बार क्यों इतनी देर
नहीं,
तक छुपा?
मैं बताऊं, इनको पहले मेडिकल में दिखाया था।
हाँ।
इनका ये पीछे की तरफ से निकला था इतना
बड़ा निकला था।
इतना बड़ा।
उसका हुआ ऑपरेशन?
हाँ, उससे पहले इनका ये मुंह आपको दिख रहा होगा, ये इस जगह से इनका निकाला था, ये भेजा था ट्यूमर बताया था, तो उसको ये निकाल दिया।
ठीक है, चलिए. So now we come to this, what we are going to do in this case. Once we have confirmed the diagnosis by history and clinical examination, now since it is an infected sebaceous cyst, the treatment differs from a simple sebaceous cyst. So if infected sebaceous cyst is, first we will have to control the infection. That is by antibiotics and by giving painkillers. So that will take care of the inflammation. Now once the inflammation subsides, we will allow for 3 to 4 weeks to pass. Till that the swelling and edema subsides. So after 4 weeks, we will do an excision of the sebaceous, complete excision and then closure of the skin. So that is the treatment. If you do any surgery now, the infection will progress further and it will be worse for the patient. So this is not the right time to treat a sebaceous cyst, except if the frank pus is there, then you need to drain it. But apparently the pus is not formed as yet, or it is not so much having pus collection inside. So it is just an infected sebaceous cyst. So now the treatment is that we give her antibiotics for 7 to 10 days and then anti-inflammatory, and then call her back after 2 weeks to see how it is subsiding. Once it subsides, the swelling will go down, color will change, and then it will return back to normal skin except for the punctum and the swelling area. So after 4 to 6 weeks, we will plan a surgery and complete excision of it will be done. Thank you. तो आप कुछ नहीं